Let's be honest, navigating women's health tests can feel a little overwhelming, right? But what if you had an expert guide to give you real clarity and confidence? Well, that's exactly what we're going to do today. We're going to demystify this whole process. Ready? Let's dive in.
Okay, first things first. If the thought of a gynecological test or exam makes you feel even a little bit anxious, I want you to know that's completely normal. Seriously. Whether it's worrying about pain or feeling embarrassed or just the stress of what the results might be, so many of us feel that way.
So you are definitely not alone. And the whole point of this explainer is to swap that anxiety for understanding. We're going to get super clear on what each test is for, why your doctor might recommend it, and what it all means. The goal? For you to feel way more empowered about your own health. And to help us do that, we're turning to an amazing expert, Dr. Farzana Khan. All the clinical insights we're about to cover, they come straight from her years of experience and the top-notch medical info she provides at the Women's Health Clinic. I mean, just look at this. Dr. Khan has over 20 years of medical experience. She's got a special interest in women's health and gynecology, plus a diploma in sexual and reproductive health. And get this, she's not just a clinician, she's also a trainer for other medical pros. So yeah, it's safe to say we are in very good hands.
All right, let's start building your diagnostic toolkit. We're going to break down the most common tests so you can really understand the why behind each one. First up, let's talk about vaginal swabs. Now, this is usually the first step if you're dealing with symptoms like, unusual discharge, itching, or a different odor. It sounds a bit clinical, but it's really just a simple and usually painless test using a small cotton-tipped stick to grab a sample.
Okay, and here's something that's super important to know. Not all swabs are the same. A high vaginal swab, or HVS, is what's used to check for things like bacterial vaginosis and thrush. But, and this is a big but, an endocervical swab, which is taken from the cervix, is what's needed to test for certain STIs like chlamydia and gonorrhea. It's all about getting the right sample for the right test. But what if your symptoms are more like heavy bleeding or pelvic pain? Well, that might point to a structural issue, and that's where a pelvic ultrasound comes in. It's a totally non-invasive scan that uses sound waves to create a picture of your internal organs. It's really considered the gold standard imaging tool in gynecology. So when it comes to ultrasounds, there are actually two types. You've got the transabdominal scan, that's the one on top of your tummy. It gives a decent general overview. But then there's the transvaginal or internal scan. And honestly, this one is way better for getting a clear diagnosis. Why? Well, because the slim probe gets much closer to your pelvic organs, giving these incredibly detailed, high-resolution images. We're talking about the kind of detail you need to spot things like PCOS, fibroids, or endometriosis, stuff that a tummy scan could easily miss.
All right, next up, sexual health screening. Let's just say this loud and clear. This is a completely routine, normal, and super important part of your overall healthcare, especially if you're sexually active or have a new partner. There is zero judgment or stigma here. This is just you being smart and proactive about your body. As you can see, different infections need different tests. Chlamydia and gonorrhea, those are usually found with swabs or a urine sample. But things like HIV, syphilis, and hepatitis, those need a blood test. And the main takeaway here is that catching things early is absolutely key. It means you can get treated quickly and effectively. Okay, buckle up because this next section is so important. We are going to bust some major myths and get straight to the medical reality. And trust me, understanding this stuff can have a huge impact on your health. Okay, here's the big one. I'm sure you've heard this, or maybe even thought it yourself. My smear test was clear, so I know I'm clean. So many of us believe this, but it is a really, really dangerous misconception. Let's make this crystal clear. The reality is that a cervical screening, or a smear test, checks for one thing and one thing only: HPV and any abnormal cells that could potentially become cancer. That's it. It is not a test for any other infection. I'll say it again. It is not an STI screen. You still need a separate sexual health screen for things like chlamydia, gonorrhea, or anything else. Okay, so another critical question is timing. When is the right time to get tested? You might think, oh, I should go get tested right away, immediately after a potential exposure. But testing too early can actually give you a false sense of security, and that's all because of something called the window period. This timeline breaks it down perfectly. Basically, infections need time to show up on a test. For chlamydia and gonorrhea, you need to wait at least 2 weeks. For a modern HIV test, it's about 45 days.
And for syphilis, the gold standard wait time is 12 weeks. If you test before these windows close, you could get a false negative result, which is the last thing you want. So, what happens when you've done everything right? You've waited for the window period to close, you've gotten the tests, and they all come back clear, but you still have symptoms. It is beyond frustrating, right? Well, there might be a missing link. And that missing link could very well be something called Mycoplasma genitalium, or MGen for short. Here's the kicker. It's not part of the standard STI test pack in the UK. This means you have to specifically ask for it. Dr. Khan points to this as a major cause of persistent discharge or even pelvic inflammatory disease. And it's so important to know about because it's often resistant to standard antibiotics and needs a specific kind to clear it up. So, look at all this information you have now. With this knowledge, you can go from being a passive patient to a truly active participant in your own healthcare. Seriously, this knowledge is your superpower. So, let's quickly recap your path to empowerment. 1. Know your toolkit. Understand what each test, swabs, ultrasounds, STI screens, is actually for. 2. Bust those myths. Remember, a clear smear test is not a full sexual health screen. 3. Respect the timeline. Always wait for that window period to close before you get tested for accurate results. And 4, ask the right questions. If symptoms just won't go away, you now have the confidence to ask your doctor specifically about Mycoplasma genitalium. And we'll leave you with this to think about. After everything we've talked about today, what is just one question you feel more confident asking at your next health appointment? Because taking that one small step, that's how you truly start taking control of your health journey.